my name is Angie Watson. This is my presentation on blood transfusion, a double-edged weapon. Blood is a lifeline for any hospital. In India, we need about 10 million units every year, but only about 6 to 6.5 million units are being collected, which leads to a shortage of approximately 35 to 40%. Since the gap between the demand and supply is increasing, millions of patients suffer due to non-availability of blood at the proper time. The only way to cope with the load of growing demands and requirements is to request and motivate more and more volunteers to come forward to donate blood to the volunteer blood donation movement. Blood and blood components are vital to the healthcare system of a country. In addition, the hemophiliacs, anemics, and leukemia patients require regular blood transfusions. Blood is required in cases of accident and surgical operations also. According to the statistics, at least 50% of the need is fulfilled through replacement donors. This leaves a gap of 50% units annually for which the main source is voluntary blood donation. National policy of blood collection from 100% of volunteers as donors. The spread of AIDS obtainable mainly from volunteer donors. The concept of volunteer blood donation is gaining popularity and benefiting the community with people coming forward to donate blood. With people coming forward in large numbers to donate blood at these blood camps. Certain myths and misgivings exist about blood donation in general, which needs to be addressed by making the public aware of the benefits of blood donation. At least 2 decades have witnessed an increased awareness in the field of blood transfusions. Advances in basic sciences such as immunology, biotechnology, genetics, cryobiology, physiology, as well as technical progress in instrumentation, have together created a significant impact on transfusion of medicine. A greater stress has been laid on volunteer blood donation since the hazards of commercial blood has resulted in endangering the life of the recipient from the dreadful disease like hepatitis and AIDS. The major aim of blood transfusions has been to make the transfusion safe and beneficial. The other aims of improvement in blood have been prolonging of the shelf life of blood and its optimal utilization, and development of synthetic substances to supplement the human source. Through better understanding of red cell metabolism, the red cell preserves are now improvised and can preserve red blood cells for transfusion up to 49 days as against 21 days earlier. Efforts are now being used for artificial substitutes, specific components of blood, emulsion, DA, and polymerized stroma-free hemoglobin solutions have been tried as red cell substitutes. Blood transfusion errors have long been a source of concern for hospitals and clinics. In blood banks, as in no other area of the clinical laboratory, the patient's life may hinge upon the mistake, be it as clerical, technical, and judgmental. The possibility of administering wrong blood to a patient is a serious healthcare issue, since incorrect transfusion can trigger adverse reactions up to and including death. Challenge and responsibility are the daily substance of blood bank worth. Stimulation and gratification are the reward. Developments over the last 3 decades in the field of renal dialysis, cancer therapy, cardiovascular surgery, transplant surgery, treatment of hemophilia and related disorders have put enormous burden on the blood transfusion services, but not for whole blood, but also for products not available earlier, namely blood components or blood selective depleted of specific cellular components. As a consequence, 3 major changes have taken place globally in blood transfusion services. Blood collected from professional sellers is generally substandard with low hemoglobin content and can be the carrier of various communicable diseases like jaundice, malaria, hepatitis B, HIV, and all alike. Blood is a double-edged weapon. On one hand, it's life-saving. On the other hand, it is endowed with dangers of transmitting deadly disease. In the 1960s, the changeover from glass bottles to plastic bags revolutionized the working of blood banks. This helped in use of the components to much greater extent and also helped in better safety procedures. The instruction of disposable too helped in much safer transfusion procedures. That added advantages of the disposables are convenience in storage, transportation, less risk of transfusion reactions, ease in separation of various blood components with the availability of pheresis procedures. The scents in the blood banks have changed tremendously as one can now produce what is actually needed.